Thank you for joining us. I'm Alan Archer, one of 2 assistant city managers for the City of Newport News. We wanted to take some time this evening to update you on what the city and healthcare leaders are doing about the COVID-19 pandemic, as well as answer your questions. I'm joined this evening by the Director of our Department of Human Services, Ben Thomas, Newport News Chief of Police, Steve Drew, Acting Director of the Peninsula Health District, Dr. Steve Julian, and on Zoom, we have Jack Hessen with Madison Government Affairs. Each one of us will provide a brief update and then respond to your questions. You can start posting questions now and keep them coming throughout the evening. We won't answer questions about schools tonight. However, we hope you will tune in next week when Newport News public school representatives will return to Newport News Television Studio for another Facebook Live event. Well, the past 6 weeks have certainly been challenging. It has been necessary to completely change the way we live and work and to keep ourselves safe and protect the lives of others. Thank you for the many sacrifices that you have made and for the creativity that you have shown while adapting to this new normal. We know that it's not been easy, and a lot of people are suffering right now, but our efforts are working. We are flattening the curve, and it's important to continue our prevention practices in order to reduce the burden on our healthcare system. Newport News city facilities remain closed to the public, but our employees are still working hard to keep the city running. Trash is being collected, parks are open, permits are being issued, and planning for the future continues. Ben and Chief Drew will talk more about our dedicated team of employees and how they have changed the way we operate to continue to serve people in need. We're going out into the field to support our most vulnerable citizens. We have created drive-up services, and we're implementing additional online services. Please visit our website for a full list of online services. And speaking of online services, I'm amazed and humbled by the number of churches, businesses, museums, and more that are using social media and online resources to stay connected. We know it's hard not to go to church, and it was especially difficult over Easter weekend. But it's critical that you stay at home and shelter in place as much as possible. Again, we are flattening the curve and should not slow our efforts now. Please continue the good work that we are accomplishing through social distancing and resist the urge to gather in groups. One question we hear a lot is, when will things get back to normal? I think I ask myself that question at least 10 times a day, and I know my teenage son is certainly looking forward to meeting and riding bikes with his friends again. At the city, we're beginning to develop a reopening plan and a strategy, but we are relying on the Virginia Department of Health and healthcare experts to provide guidance on the timing and phasing of that plan. We don't want to react too quickly and risk a resurgence. The Peninsula COVID-19 Operations Center is hosted at the Newport News Emergency Operations Center. At the Operations Center, we work with first responders from neighboring municipalities to coordinate our public safety response to COVID-19. We are joined in this effort by the Virginia Department of Health and representatives from Riverside Regional Medical Center, Centera Healthcare, and Bon Secours Mary Immaculate Hospital. Dr. Julian is leading the Peninsula Health District's response, and he's going to share more information with you about COVID-19 at this time. Dr. Julian?
Thank you, Alan. Good evening, everyone. It's a pleasure to be with you again, and I really appreciate the City of Newport News sponsoring this event. We've come a long ways in the last 6 weeks, though it may not feel like it. At that time, we didn't know as much about this disease as we do now, and at this point in time, because of the response of our citizens and the measures that have been put in place, and the excellent medical care that is provided in this community by the various health systems and providers, we have bent the curve. The number of patients who have had COVID diagnosis and the number of deaths has been decreased by the actions that have been taken. Having said that, this is not the time to let the foot off the accelerator. We need to be patient and we need to persist in these activities, the social distancing, hand washing, et cetera, that we've talked about, so that we can get through this with the minimal amount of impact on our lives. I do want to thank the citizens of the area, similar to Alan, for their cooperation with the governor's orders. And I would encourage you to watch the governor's news conferences Monday, Wednesday, and Friday at 2 p.m. We at the VDH will continue to work hand in hand with all of the stakeholders, the governmental agencies, the first responders, and what I see as a extremely well-coordinated response to this. And I just want to thank you again for this opportunity to be here.
Thank you, Dr. Julian. Vin?
Well, good evening. It's my pleasure to be here to participate in this panel this evening, and I'm looking very forward to responding to your questions. I'm the director of the Department of Human Services. We are a group of administrators, program administrators, and social workers who are dedicated to providing different kinds of social services and administering benefit programs to the community. We administer dozens of programs, as a matter of fact, many of which are funded through state and federal funds that support the health and well-being of this community. Examples would be the Temporary Assistance for Needy Families program, for instance, the Supplemental Nutrition and Assistance Program, or SNAP, that is essentially food stamps that we are able to make available. We subsidize child care. We have adult protective services specialists and child protective services specialists, and we manage the foster care and adoptions programs for the city. We have had to make quite a few adjustments in response to the recent pandemic. Of our 356 staff approximately, only 20 of us are in our building at Rouse Tower at any given time. And that is to say that most of our staff are working from home, but we're very excited to say that we've been able to maintain a vast array of services that we provide. And so we hope that you, in contacting us for services, are getting a good response from us. Surely the needs have increased in the community for the kinds of services that we provide, but we're doing our best to keep up. We rely heavily on partnerships with other community-based organizations and our partner stakeholders in the community, and so there is a robust response to services needed by our citizens here when it comes to human needs. Lastly, for the moment, I'll say that we are in charge of the city's response to homelessness as well. And we have maintained some services for people who are homeless in the community, including shower and hygiene opportunities, feeding opportunities. They are able to collect their mail and receive their benefits as normal, and their other kinds of benefit programs that they're eligible for. So that's also been a challenge, but we've tried to make sure that as many as possible are sheltered and their needs are met. And with that, Chief Drew, would you like to proceed?
Sure. Well, good evening. First, let me say thank you for taking the time to tune in. I think it's a great way for us to share information with our community and to give you the opportunity to reach out to us and ask some questions that you may be thinking about that we're not so sure that you may be interested in. So I appreciate everyone taking the time. As the Chief of Police here in Newport News, these are challenging times. These are things that we've not dealt with before, at least in our generation. And I am thoroughly impressed with the way that the men and women, both sworn and civilian, and not just in law enforcement, but as our city has come together from our management, our government perspective, our mayor, our city manager, but the men and women, the citizens of Newport News, these, like I said, these are challenging times, and how we work together has made a tremendous difference. Dr. Julian talked about bending the curve. I think it's because of the response that you all have done, the cooperation that you've assisted us with. I know times are frustrating with businesses being closed down and people concerned, especially with schools out and people being cooped up. I understand that. It's the same with our officers. I think we're very fortunate. I'm very blessed to serve in this department, work with the fine men and women of this organization. We've done very well. We've been very, we planned ahead. We had a lot of contingency plans in place that we were well prepared as we went into the shutdown and addressing this pandemic. We very well stacked with our equipment, our protective gear that the officers have, the fire department, the city health providers have been excellent in getting us the equipment that we need, and we're still able to provide those services. There's been a few tweaks. With school being out, we put our school resource officers back to assist patrol. We have our dispatchers that are asking a little bit different questions when calls come in, just screening those calls to ask if anyone is sick or has been around anyone sick. Our roll calls are a little different. Instead of meeting in a room and getting information, now it's coming a lot over our data terminals and our computers in the vehicles or cruisers. So those are just some different things. Lastly, before I hand it back to Mr. Archer, I just want to say, and a couple weeks ago we got to show it, but the men and women, the nurses and doctors that work in our hospitals, Riverside and Mary Immaculate, let me tell you, that is the front line. And we were able to get together, us and law enforcement, the sheriff's department, the fire department, myself and Chief Johnson, different agencies to get together and go up and show respect and just salute them. I wanted to sing, but they wouldn't let me. But to go up and show them our appreciation and our understanding for what they do, they are true heroes of this city. And I just think that's what sets Newport News so far above, where they're just doing a phenomenal job. So again, thank you for tuning in tonight. Hope we're able to address any of your questions, and if we're not, we'll certainly get the answers to you, but I look forward to hearing your concerns. Thank you.
Thank you very much, Vin. Thank you, Chief Drew. We received a number of questions about the CARES Act, which provides coronavirus relief to individuals, families, and businesses. Next, we're going to talk to Jack Hessen via Zoom about federal assistance and stimulus packages. Jack?
Hey, good evening. Thanks for having me tonight. Put together a slide deck just to help visualize some items here. Make sure this is our contents here. Just let you know that I'm not going to bend your ear all night. But here we'll do an overview of the CARES Act, Paycheck Protection Program that you've heard a lot about, Supplemental 3.5 as they're calling it, that just passed the House this afternoon, the Senate yesterday, and what's next, what we might expect moving forward. Real quick, the CARES Act was passed on March 27th, was the third emergency supplemental bill passed by Congress in the month of March. Its intent is to provide directed assistance to the American worker, families, small businesses, American corporations and industries, and their employees. Highlights that everyone knows by at this time were direct payments, one-time payment of up to $1,200 for individuals. Married couples could receive $2,400, families $500 per child. Payments max out at income levels at $75,000 for individuals, $150 for married couples. Unemployment was boosted by $250 billion for extended unemployment insurance benefits for 39 weeks. An additional weekly $600 federal funded payment was available to those for up to 4 months for eligible individuals that were already on state unemployment insurance payments. States and local governments with populations, local governments with populations of over 500,000 people were eligible to receive direct aid out of a $150 billion fund. $1.25 billion was guaranteed for local governments under the 500,000 person threshold. And those would be administered by states that individual governments, local governments could apply to the state for. And $30 billion was set aside for higher ed and vocational career institutions. And lastly was $500 billion available for large U.S. corporations. They're eligible for these loans or loan guarantees if they promise to retain 90% of their workforce for the 8-week period that we're looking at. The loans extended over 5 years. They cannot be forgiven, unlike the small business loans. Airlines could apply to a $50 billion fund, and $8 billion was made available for cargo carriers. Here, the PPP, as it's known, the Paycheck Protection Program administered by the Small Business Administration, initially funded at $350 billion. The effort there was to prevent layoffs and small business closures when folks were asked nationwide to stay at home. Intended for companies with employees of 500 or fewer, maintain the payroll during this time of up to 8 weeks, was the initial determination. If employers maintained the payroll for that 8 weeks and used the funds that they would be supplied for that 8-week period, covering payroll costs, benefits, interest on mortgage obligations, rent, utilities, that loan would be forgiven for small businesses. You all heard that the PPP ran out of money in less than, in under 3 weeks, for a couple reasons. One being there's a tremendous need for the PPP. It's run out of money a couple weeks ago. It's been held up for about 2 weeks in congressional negotiations. But regardless, the PPP had to be replenished. So here, the COVID-19 3.5 relief package tops out at $484 billion. Which initially, 2 weeks ago, this was a $250 billion stopgap measure to fund PPP. I'm sorry. Here, in the details within, it's kind of just a refresher of the CARES Act, but much smaller. There's the new funding for small businesses is at $320 billion. The same stipulations apply. $60 billion of the $320 billion was set aside for smaller lending institutions, such as credit unions and our community-based financial institutions, a goal of reaching the underbanked businesses. In addition, other SBA programs, which were probably underfunded, have been additional funding. The disaster loan program account boosted to $50 billion, $10 billion for the emergency economic injury disaster grants, as well as emergency economic grants were boosted from $10 billion to $20 billion. Hospitals received $75 billion, and this is in support of local hospitals and other healthcare providers, specifically for reimbursements related to COVID expenses, to include lost revenue, public health services for the uninsured that are infected by COVID-19. And lastly was a $25 billion testing program, specifically to quote, necessary expense for research development, validate, manufacture, purchase, administer, and expand capacity for testing. And of that $25 billion, $11 billion is for direct funding to states and localities to scale up their COVID-19 testing, laboratory capacities, contact tracing, and also support employer testing. The last push that many smaller community local governments were in dire need of was the ability for direct aid. Those funds were not included in the interim package, so we would see possibly that in a next supplemental bill. Here, just want to share with you what has been done since the first week of March. There's what we just passed today in the House. The president is expected to sign tomorrow. Was the 3.5. It's the interim funding bill of almost $450 billion. We should expect to see another economic package in the June to July timeframe, if things go well, of another $1 trillion or more. And then, once, this is a day-to-day event, we'll see how coming out of the summer, what the infected numbers are, what the test numbers are, who's being tested, and I think we would hope that we would see somewhat of a return to normalcy. And with that, I can take questions when you're ready.
Thank you so much, Jack. This situation affects all of us, but it's hitting small businesses and their employees especially hard. We've seen the way businesses have modified operations to stay open and keep people employed, but we know that you're struggling. Our Department of Development is identifying resources and sharing information that will help during this difficult time. Please visit our website to find out more about this information. And now it's time to take your questions. So I will turn to our host, Sarah, and ask for the first question.
All right, so people are asking about when things resume. Tyrese wants to know if we'll have a heads up, a week notice, and once we're able to return, will it be every day or sporadically to ensure safety? Dr. Julian?
That's a great question. The VDH and the municipalities are already planning the process of returning. It has to be a careful plan, and it will probably be a staged event, not an all-at-once activity. Those directives will actually come out of the governor's office ultimately. So again, keep a watch on his news conferences at 2 p.m. Monday, Wednesday, and Friday. But I think it's very important that we be very careful about how we come out of this. We were very careful how we went into it, and we ask a lot of the citizens and a lot of our healthcare system. And at this point, we need to be very deliberate about how we resume activities. Many modifications will occur, and I do not think we'll be back to exactly normal for quite some time.
Now, Alan, we are scheduled to have local elections May 5th. Will they still be held? And if so, how is the city going to keep people safe?
Well, that's another good question, and one that I anticipated, so I have a hopefully good answer for the folks who are listening in and watching this evening. So it's my understanding that during the special General Assembly session that was held yesterday, the Senate voted to pass by for the day the governor's budget amendment that would have moved elections to November. At this time, the governor has the statutory authority to move the elections by 14 days. But as of yet, I'm unaware of him giving any indication that he will do so. So until we know otherwise, we are planning to hold elections on May 5th. So we will be working very closely with the electoral board on ensuring that the polling stations are safe. We have already begun the process to construct shielding to ensure that the voters, when they go to the actual polling booth, can have appropriate safety taken into their account. So we are working on the protective equipment to ensure that to the extent possible we can ensure a safe environment and one that allows people to adequately socially distance. We'll also be calling on volunteers for assistance and working very closely again to facilitate voting, which at this particular time we are planning and preparing for on May 5th. I think that the registrar's office would also advise that if you are concerned about your personal safety as a result of the COVID-19 conditions, you can still apply for an absentee ballot. And so you can do it electronically, and I believe there is still sufficient time for you to also complete the necessary paperwork and send it in either by fax or by mail.
On the city's social media pages and post that information as well. So we'll share information about how to get the absentee ballots. So Chief Drew, will police stop me if I have an expired registration or state inspection?
Those are good questions. We get them about every day. Look, we're still gonna go out and enforce the law, and we're still gonna do traffic enforcement. But we certainly know that we may make that traffic stop to just make aware that if they're not aware that a license plate may be expired, or there may be expiration dates expired. But it is my intent, and the officers to use good discretion. They'll understand the situation with DMV and things being closed down and delayed, and the governor and allowing for some of those things to lack a little bit before they have to be up to accurate dates when they should be renewed. We understand that, and the officers understand that. So it could be, we still get traffic complaints that come in. It's kind of odd. Some citizens will call in and say, why don't we see more police or more traffic enforcement in neighborhoods? And it's something we have to be very cognizant of. You know, school's out, there are more people that aren't working, so they are home. We have to watch those neighborhoods. But then again, I do understand with the pandemic, with shutdown and frustrations with finances and people that may be struggling a little bit with finances, we understand that. So we use officers' discretion. We are continuing to be in our neighborhoods. We're continuing to enforce the law. We will do traffic enforcement, but we're being smart about it and using good officer discretion. I think that they're doing a good job with that. It's funny. It's a great question. I got 2 calls just this week from 2 situations, very, very different. One individual was stopped, and he didn't receive a ticket, and he was very thankful for the way that he had interaction with the officers. Another individual was stopped, and he did receive a ticket, and he told me, he said, Chief, I was going well above the speed limit, but the officer was very respectful. He did issue me a citation, and I just appreciated the way they interacted. So that is something that we use a lot of discretion with, but again, we'll continue to do that. So you could be, or you may not be, but we understand some of the limitations that are put on our residents and our citizens, and we certainly take that into account.
All right, this question is for Jack. Are we going to get another stimulus check around June? Marissa would like to know.
That would probably be the first check. It's been slow, IRS getting the checks out. Some people have received them now. Should expect to see them actually in May. June would be the latest. I would think another round of stimulus checks would be incorporated in the next emergency supplemental, the CARES 2. You might say. I would expect another individual payment account. Yes.
Then, in your opening remarks, you talked about the homeless, the resources available, and we have received a few more questions. Can you talk a little bit more about what the city is doing to support our homeless citizens?
Yes, a little more than a year ago, the city opened its 4 Oaks Day Service Center. And it has been a very successful effort to provide some opportunity for homeless people to receive many different kinds of services, all in one location. Human Services Department recently assumed responsibility for overseeing the management of that facility. And with our many partners, including Volunteers for America, we are doing case management with people who are homeless to help them get the counseling, the housing, employment, and mental health and other services that they need to hopefully be able to get back on their feet. It's also a place that they can go for some respite, and we've been able more recently to provide meals there and hygiene opportunities for them to shower, short-term storage of items. They can collect their mail there, and it's something that is a very good benefit to them that they very much look forward to. Recently, we've developed a method of contacting many of them with messages through their phones, and so we have a little bit of a text chain going where we can provide them information on breaking opportunities that we're making available to them. We've also been taking meals to different parts of the city where we know they are daily to make sure that they are having nutrition that they need. And we've been pretty excited about the response that we've had as a result of all those efforts. We do use the support of volunteers, and as I mentioned earlier, we have many partners that work with us there to make those services happen. Aside from Volunteers of America, we recently engaged the Hampton Roads Community Action Program to run the hygiene operation that we sponsor there, and the Community Services Board and health providers as well have helped us to round out the services that we provide.
Doc, I was, Alan is talking.
It's an area where, fortunately, we may experience some relief in the form of reimbursement from FEMA, but we have worked with some strategic partners around providing motel stays for the most vulnerable homeless, because otherwise they really don't have any municipal building to go into during the course of the day. All of the municipal facilities are closed. So normally facilities such as a recreation center or a library prior to the opening of our day service center would have been a refuge for these individuals. So it is important during these times that we think about those who are most vulnerable, who have no shelter, and we've just been very fortunate to have some partners working with us to provide them with extended motel stays until we can produce a successful transition plan to give them optional shelter arrangements.
Dr. Julian, has there been any military mobilization within the Hampton Roads community in response to COVID-19?
Yes, there has. It's in two forms. One, in our Emergency Operations Center that's active every day, we have all of the military facilities in terms of their medical groups involved in those conversations. The second way is in planning, discussing the alternative care facility structure. They have been very involved in that. And we have a third thing that is a possibility, and that is assisting with testing and delivery of PPE. So the military has been quite involved.
Alan, and also Dr. Julian, are the local governments going to reallocate funding and resources, and how are we going to prepare in case this happens again?
Well, I think that we're all, number one, doing what we can to ensure for the safety of our residents. And that's a universal theme, whether you're living in Hampton Roads or here on the peninsula or the south side. So there's a great deal of conversation, particularly among the chief administrative officials. They have a conference call that allows all of them to contact and communicate with each other through the Hampton Roads Planning District Commission. So there's a regular agenda in which they can talk about some of the challenges that they face. We also have a very tight group of individuals who are dedicated to emergency management, working in conjunction with the Virginia Department of Health. They're right here in our city of Newport News, working at the Emergency Operations Center. And their expertise in the area of emergency management really provides us with the backdrop to start thinking about planning and the phasing of opening up city operations when that opportunity presents itself. So, I have to say that this particular crisis has been unlike any other emergency management experience that I've been involved with in my entire local government career. This is not about restoring electricity. This is not about clearing debris out of the roadway. This is almost a silent enemy, one that you cannot really see, but you can certainly see the devastation that it creates. So we know that we're going to have to adjust resources accordingly. This has been particularly challenging for a lot of the city managers and county administrators for the simple reason that we're in the middle of presenting our budgets. And many of those budgets were developed prior to COVID-19 conditions. So there'll be many necessary adjustments as we go forward to ensure that we have adequate resources to continue to provide the services that our citizens need.
All right, Chief Drew. People have heard that the police are worried there will be an increase in domestic violence due to people being at home. Have there been increases in Newport News?
So when it's a great question. I look at the crime numbers every Monday and every Thursday. We go over that to make sure that we're staffed adequately, that we're in the right neighborhoods, and we're adequately responding to the particular calls that we have. I also ask for the top 3 to 5 calls that we get every day. I need to know what our officers are responding to and how we're responding. The number one call for service right now, that has been over the last 10 or 12 days, has been calls of domestic situations, whether it's domestic violence or domestic disturbance. And I look around. I talk. Mr. Archer was talking about we talk every day at 3 o'clock with the surrounding jurisdictions. We have a good relationship and we're sharing information. Other jurisdictions are seeing the same thing, and I also see it on the national headlines as well. So we have seen that is our top call that we're responding to right now. We're averaging about 20 of those calls a day. It doesn't mean that there's always an arrest, but we are responding. And I understand that. Again, we talked about frustrations, when are things getting back to normal, more people in the house, people are afraid to go outside. And I understand that. And we also talk to our officers about that. We actually put out training bulletins and talk about it at roll call, that frustrations that people have are a little heightened right now. So I want us to make sure that we show understanding and empathy. It's very easy to relate. A lot of our officers and their families as well, their same concerns that they have, we're responding to calls. So it is to answer the question directly. It's not. We weren't surprised by it. It is our top call that we're responding to, but I think we're doing a pretty good job. I think the citizens understand, the officers are understanding. And again, sometimes you just got to take a breath, maybe walk out the back door, go outside, and just take a deep breath. We will get through this together and be patient with one another. And I think it's important for our citizens to know that, as well as the officers that are responding to those calls. And so far, I think we've done a pretty good job.
This question is for Jack. Are people going to have to repay the stimulus checks, repay the money they receive, or pay taxes on this money?
Do not have to repay it, and I believe it is tax-free.
Okay. Dr. Julian, if someone had the coronavirus, are they immune from getting it again?
It's a great question. I wish I knew the direct answer. It is one of the areas in which a lot of study and research is going on at the present time. In general, when you have a viral infection, you develop antibodies to the virus. And when you do, you're no longer subject to recurrence of the disease. In this particular case, we do not have a long-term experience, and we're just learning right now about antibody responses to the virus. So the short answer is we're not sure. We think so, but time is going to tell.
Then, where do people go for food assistance?
Well, there are a number of places that people can receive assistance for food. One of the main sources is within our Human Services Department. The SNAP program that we operate does provide electronic debit cards for individuals who are income eligible to be able to use in their local grocery stores to be able to buy groceries and other supplies that they need in their homes. In addition to that, there, of course, is the Peninsula Area Food Bank. They have been providing lots of food and other donated items to families in need. They had a very large event just recently at Todd Stadium where hundreds of people came to receive food and other supplies, and that's another good source of places to go. They have lists as well of other places in the community that provide food. We're delighted that so many of our churches and faith-based organizations have stepped up to be able to provide meals and food. The Hampton Roads Community Action Program has begun a feeding program. That's a good organization to contact if people need meals in particular. And again, there are different resources available in the community. One can also call our hotline for the Human Services Department, 926-6161. And that's a good place to be able to get basic information about all kinds of things that people need for their basic human needs.
Tiffany asked a question, Dr. Julian. When people are able to return to work, are they going to have to continue to wear masks, keep up the social distancing? Is this the new way of life for us?
I think the short answer is, for right now, yes. It is wise to take an abundance of precaution until we get out of the situation that we find ourselves. I think over time, all of these things will relax and we'll get back to a more normal state. But at the present time, I think we need to understand there's a bit of a new normal.
Chief Drew, if people see more than 10 people in a business, do they call you? Who do they contact?
So, yeah, that's a really good question, and it certainly has happened. Again, before I answer, I want to say thank you to our businesses in our city. They've just done a phenomenal job. And I know the restrictions are hard, but they've been very, very helpful in following the governor, the mayor, and our city manager's directives and requests to keep businesses closed. If you see that, I would ask you to call the police department to let us know. We'll respond. I think we're very fortunate at this point. We have not had to issue any citations or any summons at all for gathering. Officers have been able to work with businesses or groups or individuals that have had where there are more than 10. It creates a concern. I've talked to Chief Johnson with the fire department as well. He's gone out himself and visited a couple locations. But so far, we've got a lot of support and understanding. And that's my intent, to reiterate and remind people of the governor's mandate. And they can certainly let us call. We'll check into it. But so far, we've been very, very fortunate, and the business community have been, as well as the faith leader community, the churches have been very, very understanding and supportive, and they've done a great job. But if you do see that and you're concerned, please let us know, and we'll address it.
Alan or Ven, are youth programs going to be able to hold summer camps or programs this summer?
Well, I'll start, and Ven may have some additional comments that she would like to share. In the mode of planning, I think that a couple things have to happen in order for us to, actually be able to say when such programs would be able to start. And we're certainly aware that we're coming up on a very active season when a lot of young people are looking for activities. Their interests are wide and diverse, and summer is normally an opportunity to do some exploration and personal development and have fun. And a lot of those opportunities may not present themselves this summer just because of the timing that we find ourselves in battling the pandemic. So we are planning for those activities. We are looking at them. We're, in some cases, announcing them and taking names to create a list so that when the program is activated, if it's activated, we do have individuals that we can contact. But I just think it's too early, certainly, to make any commitments. We just have to wait. I think Virginia has been very fortunate, in my opinion, working closely with the health department and other experts. We've really been able to see whether it's my use of the term flattening the curve or Dr. Julian suggesting that we're bending the curve. We are seeing an impact of what we are doing in terms of freeing up resources in the healthcare system and actually seeing a drop-off in the number of positive cases here in Virginia. And I think the Peninsula and Hampton Roads is certainly included in that observation. So we are very mindful of what we have to work through, and we want to do it, as Dr. Julian said, in a very safe and effective manner. We are not going to risk the public's health until we are absolutely certain that these programs and activities can occur.
And I would have to say that I certainly agree with Alan. It's a little early to be able to firmly predict whether we'll be able to reinstate some of the youth programming that we normally would be sponsoring for the summer. But we are planning some things in the event that we are able to carry them out. We're also looking at how we can do some of our activities virtually. And so I think that in the short term, you will certainly see some activities that normally we would be looking to conduct in real life, looking at virtual and very creative versions of those. So let's hope for the best. It is very encouraging that the curve appears to be flattening here. We just don't want to have a rebound effort later in the year. So I think most of us are going to be looking to be extra cautious in that regard. And I'd like to add a little bit to an earlier response related to food provision here locally. I neglected to mention one of the largest meal providers right now, which is the public school system. They have really been making an effort to ensure that children who need food and meals are able to access them. They've developed more than 20 access points for students, and they have mobile opportunities where they bring it out into the community as well. And they're looking at trying to expand upon that to provide more than 2 meals a day. So they deserve a lot of credit for the effort that they're making to ensure that children are able to still get the meals that they need. The other thing I wanted to refer to is the way that one would apply for any of our programs, including the SNAP or food stamp program, and that is to go online and to our commonhelp.virginia.gov website, and all the information that you need to see whether you're eligible and to apply is right there online. And we are processing those applications as quickly as possible so you get a relatively quick response when you apply.
Dr. Julian, our next viewer has said they've seen people wearing masks in their car. Is this something that should be done? When should people wear masks and gloves?
That's a great question. I would say that you should wear a mask in the car if you're in the vehicle with other people, because remember, that's not keeping your social distancing. It's nearly impossible in the average car to keep 6 feet apart of the rest of the folks. So at that point, I would think it's a reasonable thing to do. However, if you're driving along by yourself, I really see no way to advise doing that. I think the use of masks is going to be something that we're going to see for the foreseeable future. It certainly protects the rest of the public from your own secretions. That's probably the greatest benefit of using them. And we know that this virus is transmitted through respiratory means. And the other thing is that I think we are also learning that there are probably more COVID positive citizens, people, than we know. Because testing, though it is becoming much more available, is still not as widespread as we need. And I am suspicious that there are a number of asymptomatic patients or folks. They do have the infection, but they have very little response to it themselves. It's not causing them any serious medical illness. However, they could be a vector, a point at which the virus could be passed to another person. The wearing of masks has been shown to reduce that tendency. So I think it's going to be with us a while, and I think we just need to get used to it in our public discourse.
Chief Drew, is there a curfew in the city?
So there is a curfew, but we kind of looked at it lightly. We'll respond to our neighborhoods and patrol them. We want to look out for our citizens, right? So those laws haven't changed, but again, I think that we're in a different time, right? So if people are outside on their front porch or in their front yard or on the sidewalk a little later, we're going to be a little bit more lenient with that. Now, an officer may come by and remind them of that, but we have to remember and that things are different now, and I want to work with our citizens. So I guess the correct answer is there a curfew? Yes. Are we enforcing it? We're going to remind people. We certainly don't want people running around the city all hours of the night. But we do want to be respectful that we understand that sometimes people need a little bit of a break to get out in the cool night air, breathe some fresh air a little bit later in the evening. We understand that, and we'll address it on a case-by-case basis. But there certainly still is a curfew for our youth, but understand we may address it a little different if that answers the question.
Then, are any daycares open for children of essential employees?
Thankfully, yes. There are daycares that are open to serve the children of essential employees. People can contact the Boys and Girls Club for starters, but there is also a referral line that's been set up. It is 1-866-KIDS-TLC or 1-866-543-7852. Thankfully, the governor was able to allocate recently $70 million from CARE Act funding to bolster the money that was available for child care centers to be able to serve the children of essential workers. So that has been a big boost to the local daycare economy recently.
And I might add in the follow-up that we provide to this feed that goes back out to those who are watching, I'd like to do what I can to provide some resources for those who don't have access to face masks. I do agree that face masks are going to be with us for some period of time, and there are lots of websites out there, including the CDC, that provide some very simple instructions for you to make your own. They are, challenging to order online simply because of the demand. You may have to wait a couple of weeks or longer for them to arrive in the mail. But there are some nonprofits right here in our own city that are manufacturing fabric masks for those who don't have access to them. And so I do think that's a basic prevention measure that everyone should take advantage of. Have it on your person, keep it with you, so that you can always deploy it and use it.
And Chief Drew, a follow-up to the last question. What is the curfew time for youth?
So we usually start looking at our neighborhoods around 10 o'clock for our youth that are outside to make sure that we're following those things. But, it's important. I don't want to draw a fine line. 10, 11:30, that's when we would stop and maybe make recommendations or remind someone to be inside watching those areas. But I understand that there's some different scenarios and different needs, and maybe an individual is walking to a location to provide something that's needed for the home. We understand that. So please don't take offense if we stop and ask, and if we ask an age or do you live in the neighborhood, are you okay, do you need anything? But we'll work with those individuals. And let me say, I guess, two things. One, that has not been an issue for us. I am very impressed with our young people and the youth of this city for how well that they are. I can't imagine, issues with school being out and not getting to interact with your friends and sporting events or go to those events. That's a lot. But I could not be more impressed with the youth of our city. I think that's a tribute to our school system, our teachers and principals interacting with our students. We tried to reach out today with, I'm going to get it wrong. Is it Zoom and some of the different techniques to talk to kids online? I reached out to our young adult police commissioners before I came here. We had a really good conversation, but they're going through a lot. And I think, again, we need to be a little understanding of that. And at the end of the day, the curfew is to keep our citizens and residents safe, but we're going to use a lot of discretion with that right now. Our focus is keeping our citizens and our youth safe, and that is not, when I talked about looking at our calls for service, that has not been a problem for us this far.
There is a city council meeting scheduled for next week. Will it be held virtually? And if so, how do people share comments?
Okay, the next city council meeting will be a virtual city council meeting. And actually, if you go to our webpage, nnva.gov, you can see right on the main landing page a link which will allow you to find out exactly how you can submit your comments. But essentially, you can do it a number of different ways. They can be accepted by phone, by email, through the use of our website, and regular mail. And so if you visit the website and go to the window that talks about how to leave comments for city council meetings, you can have access to any one of the sources that I just referenced. And we also, as many of those may know who are watching, we do have an open public comment period on the city manager's proposed budget. And so we are welcoming comments on the budget as well. And that public hearing will remain open until Tuesday, April the 28th. So there's still an opportunity to submit comments about the proposed operating budget for the next fiscal year.
We are nearly out of time, and this final question is for anyone who wants to weigh in, anyone and everyone. We've all been affected personally and professionally by the coronavirus. What's something you've learned about yourself or our community that will forever stay with you as a lesson?
I think I've learned that people really are truly amazing and resilient. You see so many approaches to just moving on with life that I think people may have just overlooked or taken for granted. And so I'm amazed at the role that technology is playing. We were just talking about the budget and sort of the continuity of operations, and so things can't stand still. Many are moving forward. We're communicating with each other using WebEx, using Zoom, using all kinds of acronyms that just months ago we probably would not have been very familiar with, but now we're very familiar with them, and they become a part of our normal, our new normal, I guess I should say. So that's one particular aspect about what I have seen here in our community: the resilience of people, the fact that they are standing together to work through COVID-19. And my own personal takeaway is that I'm going to adopt the philosophy of my friend Chief Drew, and I think I'll just shave what I have left so I don't have to go back to the barbershop. So,
he just threw that to me, right? So, I was worried about coming on today about the glare, so I hope it's not blinding anyone. For me, what I've learned about our community is we need each other, that we rely on each other. And that through teamwork and working together, there's not much that we can't accomplish. There may be challenges, curveballs, right? But I see our first responders, I see our health professionals, I see the way that we communicate, our citizens, our community, our schools, our youth, all the different resources we have in this city. I think that's what makes Newport News special. And that has impressed me. This is challenging. I've seen how it hit other cities. And I just see, I guess, Alan, with the words that he used, resolve, how we come together to face this head on. We're going to come through this together as a city, as a team, and I'm impressed. For me personally, my family is back in Ohio. I know my parents have cabin fever. They're wanting to get out and go to church and go shopping. And it makes it relevant to be able to, I think, here now, in this time, every individual can relate to other people. We understand what it's like to not be able to do things the way we have always done it. And we find new ways to do that. And I think that's made me kind of take a step back and look at just how much we're in this together and we're going through this together. So for me, it is the great spirit of this city, how we're working together to overcome this. And I just appreciate the leadership in our city, our health professionals, our community and youth, our schools, everybody coming together to address this and help one another. We need each other. And I think that's how we're going to beat this virus.
I would have to agree that the response that the city has managed to pull together with so little real preparation, in a sense, for this type of emergency has been amazing and very, very impressive. Our Department of Human Services I've always considered to be the heart of the city, given the work that we do and the number of lives that we touch. But our collective response to this emergency has been nothing short of amazing. The work that people have bound together to do, how responsive they are, no complaints, even though there have been many difficulties and things that we've had to work through to continue to provide services to the community. We have managed to do it, barely skipping a beat. And that's a real testimony to the dedication of our team as well as the larger city team, because we're all working together to be able to continue to do what needs to be done to help this city continue on and provide the services that our citizens need. So it's been extremely rewarding to participate in that. And personally, I have just been bolstered by the spirit that generates within me. I am typically a very busy person who is calendared every moment of the day. I had several trips, professional and personal, that had been planned, and I'm struck by how an emergency such as this one kind of makes you sit still for a minute and think about what's really important to you in life and what is necessary, what you need to be focused on or not focused on. And I've certainly learned that my family, my home, my team, my community are the more important things, not necessarily all those other things that were filling my calendar day in and day out.
I've been gratified by the courage and dignity and professionalism of our first responders and our medical providers. Having been in medicine for a long time now, I knew these things. I observed them over the years. I was never sure the public really understood the sacrifices that these individuals make in their personal and their professional lives to respond to the needs of others. So I would summarize it as thank you to the first responders and medical professionals, and thank you to the community for cooperation with these drastic measures that we've had to take. And I would thank the administrative folks, the elected officials, and everyone for how we've come together to beat this pandemic together.
Well, I want to thank everyone for tuning in this evening. I particularly want to thank the panelists who were able to join me tonight. I know that we could not get to every question tonight, so we will post responses on the feed in the coming days. You can also call our 311 center with general questions at 757-933-2311. And as so many of us have said this evening, we're dealing with new and unexpected challenges. But we will make it through this tough time together. So please take care of yourselves, be kind to one another, and stay safe. Good night.